Aspirin, also known as acetyl salicylic acid, is a non-steroidal anti-inflammatory drug. It's derived from salicylic acid, which is found in the bark of willow trees, which are used to relieve pain, reduce inflammation and fever. It's also used to prevent heart attacks and strokes by inhibiting blood clotting. Recently, it is used as a cardiovascular drug due to its antiplatelet effect. So first, in this video we will discuss pharmacology of aspirin, including how it works, dosage, and the potential adverse effects and its interaction with other drugs. Mechanism of action, or how aspirin works. Whenever there is an inflammation, the membrane are taken up and converted into arachidonic acid by an enzyme called phospholipase A2. This arachidonic acid is then converted to prostaglandins and prostacyclin by the enzyme cyclooxygenase 1 and 2. Prostaglandins are chemicals in the body that cause inflammation, pain, and fever. Aspirin does this by irreversibly blocking the action of an enzyme called cyclooxygenase COX, which is involved in the production of prostaglandins by inhibiting COX. Aspirin decreases the production of prostaglandins, leading to a reduction in pain, inflammation, and fever. The COX enzyme is also involved in the production of thromboxane, which promotes platelet aggregation and blood clotting by inhibiting COX 1 and 2. Aspirin prevents the formation of thromboxane, which can reduce the risk of blood clots. And they also act on the hypothalamus to set the temperature set point at a higher degree, causing fever. Dosage of aspirin. The recommended dosage of aspirin depends on the condition being treated for pain relief and fever reduction. The usual dose for adults is 325 to 650 milligrams every 4 to 6 hours as needed. Up to a maximum of 4 grams per day for the prevention of heart attacks. The usual dose is 75 to 325 milligrams per day taken once daily. However, the recommended dosage may vary depending on the individual's medical condition, age, and other factors. Route of administration. Aspirin is usually taken orally, and a major proportion of the drug is absorbed by the small intestine. Its oral bioavailability is about 75%, and it is available as suppositories and for preparations as well. In the liver, aspirin is hydrolyzed into salicylate. This is the actual anti-inflammatory metabolite of aspirin, but unlike aspirin, it has no antiplatelet effect. Elimination of salicylate is primarily renal. Salicylate works by inhibition of COX-2 enzyme, and this reduces the synthesis of prostaglandins, which ultimately reduces inflammation, pain, and fever. So aspirin is indicated in conditions like headache, musculoskeletal, and dental pain as well. In addition, aspirin is used in the short-term management of chronic pain, including osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. And also used in the long-term management of cardiovascular disease such as after or during a myocardial infarction. This will prevent new clot formation and further damage to already ischemic myocardium. Most of the time is given along with other anticoagulants like clopidogrel to increase the efficacy. Now let's see some common adverse effects. Taking aspirin can have some adverse effects. When it inhibits the COX-1 enzyme in the stomach, it lowers the production of protective prostaglandins. This reduction can lead to issues like gastritis, gastric ulcers, and bleeding. Moreover, aspirin inhibiting COX-2 in the kidneys decreases the synthesis of prostaglandins, which normally help dilate renal arteries. This, in turn, can cause a decrease in blood flow to the kidneys, potentially resulting in acute kidney injury. Additionally, the lowered blood flow activates the renin-angiotensin-aldosterone pathway, leading to increased blood pressure or hypertension. And another important fact to remember is that aspirin should not be given to reduce fever in children with viral infections because it can cause Reye syndrome, which is characterized by liver damage and encephalopathy. Another serious adverse effect of aspirin poisoning. It is a medical emergency and occurs due to aspirin overdose, commonly seen in children, and attempted suicides. Tinnitus, vertigo, deafness, nausea and vomiting, and respiratory alkalosis. Drug-drug interactions of aspirin. Aspirin can interact with other drugs which may increase or decrease its effectiveness or cause side effects. Aspirin can increase bleeding risk when combined with anticoagulant drugs such as warfarin. And taking other NSAIDs as naproxen is potential increase the risk of gastrointestinal side effects, stomach ulcers, and bleeding. Aspirin can also increase the levels of methotrexate and might reduce the antihypertensive effects of ACE inhibitors. Taking antacids with aspirin can decrease its absorption and effectiveness. That's all for today. Thanks for watching and subscribe to my channel for more content on health and medicines. Stay healthy, stay happy.